Welcome to Dental Academics. In this video, we shall study the anatomy of the maxillary central incisor. Central incisor is important not only functionally but also aesthetically because of its central location. We must be aware of the anatomical details of the central incisor so that it can be rebuilt and restored properly in case of damage. The maxillary central incisor is located in the maxilla in the center and is usually the most visible of all the teeth in the mouth. Its main function is to shear and cut the food by its sharp incisal edges. Its name is derived from the Latin word incidere, which means to cut. The tooth is generally studied from 5 different aspects, that is, the labial, lingual, mesial, distal, and incisal surfaces. This is required to study the tooth anatomy in a more systematic and organized way and to avoid missing out any relevant details. The labial aspect of the tooth is the side facing the lips and is visible on smiling, and the lingual, or more correctly the palatal aspect, is the aspect facing the palate. The mesial surface or the medial surface of the incisor is located closer to the front of the mouth and midline. The distal surfaces are those surfaces which are located lateral or distal to the midline and closer to the back of the mouth. Biting or incisor surfaces are the portion of incisor that is sharp and straight to facilitate the cutting of food, and the junction of the incisal and labial surface is called the incisal edge. The permanent maxillary central incisor is the widest tooth mesodistally in comparison to any other anterior tooth. It is larger than the neighboring lateral incisor and is usually not as convex on its labial surface as the lateral incisor. As a result, the central incisor appears to be more rectangular or square in shape. The mesial incisal angle is sharper than the distal incisal angle. When this tooth is newly erupted into the mouth, the incisal edges have 3 rounded features called mamelon, which slowly get worn out to give a sharp incisal edge. The cervical outline of the crown follows a semicircular direction, having the curvature towards the apex of the root. The root from the labial aspect is more like that of a cone with a blunt or rounded apex. 2 straight shallow depressions can be seen on the crown, which extend from the incisal edge towards the gingiva and fade out in the middle third. The 2 developmental depressions are the mesolabial and distolabial developmental depressions, and they represent division of the 3 labial developmental lobes. We can also appreciate faint curved lines which roughly parallel the cemento-enamel junction in cervical third of the surface, called the imbrication lines. But the imbrication lines are not always present. The height of the contour of the labial surface is located in the cervical third, which can be better appreciated from the mesial aspect. The lingual outline is the reverse of that found on the labial aspect. The lingual aspect has both convexities and concavity. The outline of the cervical line is similar to that of the labial aspect, but immediately below the cervical line is a smooth convexity called cingulum. The lateral margins are raised on the mesial and distal side, called the mesial and distal marginal ridges respectively. Between the marginal ridges and below the cingulum is a shallow concavity called the lingual fossa. The lingual fossa is bordered mesially by the mesial marginal ridge, incisally by the lingual portion of the incisal ridge, distally by the distal marginal ridge, and cervically by the cingulum. Developmental grooves extend from the cingulum into the lingual fossa. When viewed from the mesial aspect, the crown appears to be wedge-shaped or triangular, with the base of the triangle at the cervix and apex at the incisal ridge. A line drawn through the crown and the root from the mesial aspect through the center of the tooth bisects the apex of the root and incisal ridge of the crown. This is characteristic of the maxillary central incisor. The cervical line on the mesial aspect curves towards the incisal ridge. The labial surface of the crown is convex, whereas the lingual surface of the crown is convex near the cingulum and near the incisal edges, but is concave along the surface between these two areas, making the outline S-shaped. The distal side of the tooth is very similar to the mesial side, but greater portion of the tooth surface facing the lip is visible from this view compared to the mesial view because the labial surface tilts distally and lingually. Also, the cervical line curves less in comparison to the mesial view. From this angle, only the crown of the tooth is visible and the overall tooth looks like a triangle. The labial surface appears broad and flat, and the lingual surface tapers towards the cingulum. The distance between the mesioincisal angle to the cingulum is slightly longer than the distance between the distoincisal angle to the cingulum. Let us see the average dimensions of the central incisor. The crown length is generally 10.5 mm, whereas the root length is 13 mm. The mesodistal diameter of the crown is 8.5 mm, whereas the mesodistal diameter at the cervical line is 7 mm. The labiolingual diameter at the crest of curvature is 7 mm. The labiolingual diameter at the cervical line is 6 mm. The curvature of the cervical line on the mesial and the distal aspect is 3.5 and 2.5 respectively. If we see the chronological status, we can see the first evidence of calcification at 3 to 4 months of age, whereas the crown is completed by 4 to 5 years. Eruption is seen at 7 to 8 years and the root completes by 10 to 11 years of age. Thank you for watching the video. If you like, please subscribe.